Well, thank you, Mr. Chairman, and once again, I want to thank you for holding a hearing outside the bubble in Washington, D.C. I know many members like myself go home every week and listen to our constituents, but having these hearings around the country is really important for us to be able to talk with people in, I use the term, the real world, as opposed to what's going on in Washington. And it's great that we're able to take this information to make sound policy decisions. I'm just going to dive right into questions today. I've got a lot of things to go over. And Dr. Suarez, thank you for your testimony, and I want to thank you for what you do to help advance medical breakthroughs in the country. And cancer's impacted most of us, if not personally, then a family member or a close friend. And there have been so many innovations in the field of cancer treatment. Can you talk a little bit about why it's important for the United States to remain the leader in medical innovation?
Thank you for the question. We are extremely successful in medical innovation. There's so many pathways that it's so important for us to continue to be the leading. It's important for our patients, for our communities, for our economy. The amount of economy revenue that's generated from research in many aspects is also huge. So from the aspect of healthcare and delivering healthcare to our patients is key, is also economically important. And also, if we keep our drugs here, we don't have to depend on other countries to supply, because as was mentioned, drug shortage is a huge issue. And I also have not been able to provide chemotherapy drugs and symptom control management drugs to my patients because they are not here. So it's such a multi-level importance that we continue to lead all these efforts.
Yeah. Well, thank you. And Mr. Watanabe, you've heard, and I know you talked about it. Our chairman talked about it, how important our research and development is, and the issues there, and just how important that is for medical R&D to help save lives. I've been a fierce advocate of making sure that the tax code encourages U.S.-based research and development. And how does, you talked about it a little bit, but you want to talk some more about how the tax code helps, does impact the R&D that gets developed, and what other points we need to do in Congress to help make sure that and encourage innovation in the U.S.?
I think I mentioned in my comments, I think first of all it's important to recognize that most of the innovation that's happening now is happening in small companies, companies like mine, and not companies who are generating billions of dollars of profits from existing drugs. And as a result, capital is probably the most important thing for small companies like mine. It's very expensive to develop drugs. I mentioned my company spent almost $1 billion getting our first product to market with no revenue. So this committee in particular, and Congress more generally, policies that foster our ability to acquire capital, like the tax code changes that I mentioned, but other measures that foster an environment that is friendly to capital formation for small companies is vital, because that's what gives us the resources to run the clinical studies, to do the basic research that leads to the medical innovation. And then I think the other aspect that Mr. Cullimore touched on is M&A. Most drugs are developed, new drugs are developed by small companies, but they aren't marketed by small companies. Typically the company is bought, or the drug is bought, by a large company. And that M&A activity is critical to then getting the medication to patients. And some of the steps by the FTC in particular against mergers and acquisitions is really actually going to inhibit R&D and the ability for us to deliver new drugs to patients.
Thank you for those comments. I mean, a lot of times in my conversations, a lot of folks have said, well, research and development only helps big companies, but it's really the small ones that are so much more greatly affected through that. It's critical that we keep innovation here in the U.S., but it's also critical that we make sure health care is affordable. My home state of Kansas, there's a lot of rural Kansans, as we've talked about today, and we need telehealth to help make sure we have better outcomes. And unfortunately, some of the higher costs driven by the incorrectly named Affordable Care Act a decade ago have prevented Kansans from getting some of that medical care. And as we mentioned before, or has been mentioned earlier, the so-called Inflation Reduction Act is only making it worse. And so we need to make sure that As we look ahead, CBO, the Congressional Budget Office, is already projecting that premiums are going to go up, and that seniors will have fewer drug choices in their drug insurance because of these disastrous pieces of legislation. So I want to make sure as we look forward that we can actually implement policy that helps make sure that we have drug treatments and other treatments available to patients. So thank you all for your time in being here, and I'll yield back.